Hey, great Tuesday evening. It is an amazing day. It is Tuesday, right? Yeah, Tuesday evening. It is an amazing day in the city of Brownsville. It's been an interesting one. There's a lot of topics to talk about, but we really want to go into uh, the medical part of it. And I say the medical because it's always an honor to have Dr. Eder Hernandez here with us. Let me tell you guys, if there's someone to go to in regards to what's going on in the city of Brownsville and in Cameron County, I would pick no one other than Dr. Eder Hernandez. He's been on top of this since way before anybody else in the valley was out there even testing or doing anything other. So again, I consider him one of our local experts in regards to this. And I'm very, very appreciative for his time. Very, very busy man. And again, one of the things that I've always said, guys, is that a lot of these folks, they dedicate hours upon hours a day, and they have to give a little bit of time to their family as well. So having him come on is just amazing. I'll go quick. Well, before we start, my prayers out there to the Balboa family. We lost an amazing uh, teacher, music teacher here in the city of Brownsville. And our prayers to all of our BISD family, Puget Elementary, and to the Balboa family. As our heart goes out there, and we hope that these deaths and everyone else that has been in contact with coronavirus does not go unforeseen by our local leaders and our local leadership. So our prayers to everyone out there. We did have a county report, 307, 307 additional positives here in Cameron County. 179 of them are from the city of Brownsville. They are finally starting to report deaths, and we have 15 deaths out there. 13 of those are from the city of Brownsville. And again, very sad, and prayers to everyone that has lost loved ones out there. Good evening to everyone that's coming on. Again, guys, it's going to be hard to get to all your comments, but please, we're going to try and get to the questions. Dr. Hernandez, thank you for being here with us tonight.
Well, thank you, Frankie and Erasmo, for what you're doing. The reality is that we're considered a local expert, but humbly we're just doing our job. We're growing and we're learning about this disease that came in to ravage our community and take the lives of innocent human beings. And we wanna thank you for your shows that you put on, and you're inviting doctors like Dr. Saavedra, an excellent physician, and people like myself that have been in medical practice for some years in the community. So with that being said, I think July 18th, Dr. Fauci, which is the cornerstone here in the United States as the medical expert on infectious diseases. He's the head of the NIH, put out a very nice report. As you know, I'm always up to date, reading, staying afloat, trying to survive, trying to beat COVID, trying to figure out a way on how to prevent deaths in our community. And Dr. Fauci put together a really nice update, and I think those are the slides we'll be going over, and that this is going to make people a lot more understanding and really look at what the virus does more on the medical aspect today.
Great. Doctor, before we go into your slides, sir, one of the things that did come out, and again, it's been the talk of the town, was the press conference that the Cameron County judge had yesterday. And Dr. James Castillo, made mention that, guys, that our not death toll is very, very behind. Very, very behind. I think he dare say maybe 4 weeks behind. And that, these next coming weeks, we're going to get a lot of those dead that have passed away. Can you hear me, Dr. Hernandez? Dr. Hernandez, can you hear me? No? All right. Well, one of the things that has come out is in regards to the deaths. Guys, so throughout this next...
Frankie.
So throughout this...
I can't hear any of you guys speaking.
So throughout this next week, we are going to experience a lot more deaths coming in. It's not going to be a good thing, guys. It's not going to be a good thing. Now, one of the things that I think is very, very impressive is that a lot of these individuals that have passed away, are not on these lists. They're not on these lists, and we need to make sure that we, try to do our darndest to have the utmost information and the most up to date information out there. And again, it's very, very, very concerning. And we've sort of lost voice with Dr. Eder Hernandez, but we're hoping to work on it, guys. President of Balboa family, he was a wonderful music teacher, 100% out there at Puget Elementary. Eager to hear Dr. Hernandez, what he has to say tonight. So let me tell you, so do I. Good evening, Albert. What's it going? And now that deep condolences for to a jailer. Yes, my prayers also. Again, one of our jailers out there passed away also from coronavirus. And again, it's something that we're going to have to discuss later on in regards to the county not reporting the number of positives at the jail. Again, all these things, they have to be questioned, guys. Dr. Hernandez is having a little bit of technical difficulty, but we surely will come back to him and give us an opportunity to go through all these. Dr. Hernandez knows who he's talking about. Amen. That's why we want him back. Hey, Dr. Hernandez.
Yeah, we're good. We lost your audio. I can hear you now.
Good. Dr. Hernandez, one of the things that Dr. Castillo made mention out there was the great number of individuals that have passed away and they're not being reported and had not been reported. One of the things that I think is very important, Dr. Hernandez, is to have the most accurate information out there so that our leadership here in the city can make appropriate decisions. How important is the number count, sir?
So, first off, I want to congratulate Dr. Castillo for his honesty.
Yes.
The man, I've spoken to that man multiple times. We have conversations, at least even through text, on a weekly basis. And I can tell you, there's no one better running the Cameron County Health Authority. That being said, he's limited by resources and by a pandemic that is obviously overtaken the county. Now, he's told me, please tell the people that if they test, if they're negative or positive and they're waiting for a test, they don't know the results, they need to be in quarantine. And the issue is here, people test, go home, believe are not infected, and then are out in the community when they're told otherwise to be in medical isolation. And they create, they're possibly, they're symptomatic because they're testing, but they're spreading the virus. So it's extremely important. They mentioned they're about a month behind, correct, on this. So it's a sad reality. It's a serious matter. We've been talking about it for months, and now now we have the Grim Reaper here, and people are very scared. People are scared, and people need to be scared because you haven't followed the instructions and the recommendations. And Dr. Castillo is also, he's a human being. He's not any superhuman. He's asking people to follow guidelines, and if you don't follow them, there's going to be repercussions. And unfortunately, the hospitals are feeling it. The intensivists like Dr. Jamil Mahdi has been speaking quite a bit on the Texas Tribune and other social media platforms. He's intensivist. We don't have a lot of these experts around that are working inside the hospital as intensivists. Imagine if those physicians get sick from COVID-19 and they need ventilation. Who's going to take care of them? Yeah. It's a sad reality, and I'm glad that Dr. Fauci put together a great report for us.
And before we go there, and I don't want to lose these questions, Doctor, if a person can get the virus twice, will the side effects or the after effects be worse than what can a person expect?
So right now, what we know is that this virus started in China, in Wuhan, China, in December 2019. The reality is, hey, Dr. Diego, saying hi to you as well. The reality is, we know that immunity or memory antibodies are present anywhere from 3 to 6 months. We don't know what the after effects of that is. Is it immunity for long term? Is it a short term immunity for 3 to 6 months? So right now we cannot speak to anything more for the reality of the now. So some people are calling reinfections. And they're not reinfections at Erasmo. These people are testing too early.
Okay.
Now, you can test positive up to 4 weeks after your first positive test. It does not mean you're infectious. It does not mean that you're spreading the virus. It's just you have some of those RNA particles. That is the reality. So on retesting, there is new guidance at Erasmo for the employers. They're not recommending retesting anymore. I'm going to post you the link from the CDC. As of yesterday, the CDC does not recommend symptom-based testing, and they got to go by what the county orders, and then there's a clearance form by the county. So that's also a misconception on the employer side, asking for too much of these tests when there's other people that are needing a test. So we need to address the people needing a test first instead of people wanting to retest too early to go back to work. That unfortunately right now is not feasible.
Doctor, what options would the county have in regards to lack of resources? We are getting numbers, weeks from them being reported. What options do the county has, and is there a possibility that the state should or could be involved in the future?
Well, I'm close to the judge, and I think he's done an excellent job. And I know that today he had a teleconference with the governor. Is that yesterday or today? So he had a conversation with the chief of emergency management for the state of Texas. So he must be, when it comes to Trey Mendez, our mayor, and Judge Eddie Trevino, those two gentlemen are on top of it. We're lucky to have leadership that is actually looking for solutions, not waiting for disasters. I mean, and he must be thinking of needing resources. So I'm pretty sure he's discussing that.
Dr. Hernandez, would you want to share with us the Dr. Fauci's graph real quick before we go to any other questions?
Sure. I think that's the most important thing out of today. So let's go through the update.
If you could blow me up, Erasmo.
Okay, guys. So this is the COVID-19 research response that Dr. Anthony Fauci, the director of the NIH, did on July 18th to the American Osteopathic Association House of Delegates. So it's a very up-to-date, a quick COVID-19 information that every American citizen, every U.S. Citizen, every Brownsville resident should be aware of. So we're going to go ahead and kind of move on with the presentation. So coronavirus, there's multiple phylogenetic trees from the coronavirus. This is a subset of beta coronaviruses. And believe it or not, Erasmo and Frankie, human coronaviruses the reality is that they're very common, and they do cause many common colds, guys. So this is a novel strain of a beta coronavirus, and the reality is that it's so new that it's causing lots of havoc here in the United States and around the world. So we'll move on to the next slide. So when you look at the virus, and Frankie, when you study this virus, let's look at the virology of the virus. It's a beta coronavirus, and it's very similar to the SARS pandemic virus from the 2002 outbreak of SARS. Now, this virus is an RNA virus, and the key structure of the virus is that it has these spikes, this is the reason why it's called coronavirus. It has some spikes, and the main spike that we're concerned about is it's a protein spike on the nucleic acid of the virus that attaches to the membrane of the host cell, and when that attaches, it comes into the human body. That's called the S protein. This is particularly where our government and our private entities are looking for vaccine efforts and vaccinations, guys. So this is important to know. Now, if you look at the bottom portion of that, there is something called ACE2 receptor. And that ACE2 receptor, Frankie, is a receptor that our body has in our respiratory tract and even in our GI tract. And this is where the virus attaches and comes into our body, which is one of the main symptoms of this is cough, because there's so much of this ACE2 receptor in the respiratory tract, and it's one of the hallmarks of the disease is the cough. Next slide. So transmission is important, Erasmo, we keep hearing social distancing. These are hard facts from the NIH, from the CDC. It has been proven that the virus can transmit from person to person if you're less than 6 feet, guys. So there's respiratory droplets are up to greater than 5 micrograms. They can travel. There's some recent talks about these micro droplets going through the air AC vent systems. I think that's something to be studied. We also understand that the virus also stays in contaminated surfaces, guys. So it's important to focus on this, Frankie. Also, the virus is found in stool, blood, semen, and ocular secretions, guys. So believe it or not, if you go to HEB, I keep seeing people go in and out of the restroom. Please go to the restroom before you visit HEB. The virus is shed when you go to the restroom, guys, to the stool. Okay, it's possibly found, for sure it's in stool, it's in semen, and it's in possibly even in urine. So please, all these body secretions are important for people to understand how we're getting the virus secreted. Now, this is an important slide, Frankie, and I'll kind of let you read it, and then we'll talk about it.
Prevalence of asymptomatic SARS-CoV-2 infection, a narrative review. Data from 16 cohorts, total 45,000 plus. Asymptomatic persons account for 40 to 45% of SARS-CoV-2 infections.
Guys, this is very scary, okay? This is brought forward by the Annals of Internal Medicine. They looked at 45,000 individuals, and out of those 45,000, they saw that 45% of people were asymptomatic carrying this virus. When you want to talk about the reality of the disease, 20,000 of those individuals were carrying the virus without even knowing. Okay, this is very serious. If you have an asymptomatic child, Erasmo, go into a classroom, and that child infects an immunocompromised teacher with diabetes type 2, that's a serious complication that can arise from that infection. Why? Because 40 to 45% of people are asymptomatic, which means that they feel fine, they look fine, they act fine, but have the virus. This is a big, big issue with how this virus is being transmitted and how we have community outbreaks. The second set here, can you read it for me? Because some of the comments are blocking there. There you go. So the issue here is how it's so hard to contact trace. Erasmo, how do you believe it? It's something almost impossible to contact trace anyone that's asymptomatic that hasn't tested. That is where the virus becomes a puzzle. You cannot identify the asymptomatics, yet they're spreading that virus. So in the Journal American Academy Association came out with the carrier transmission of asymptomatic carrier transmission, and it's serious, guys. This virus spreads very quickly and very rapidly, and specifically in asymptomatic individuals. So we know that the virus travels less than 6 feet. Keep your distance. We know that the virus stays in infected surfaces for X amount of period of time. And we know that most people, 45% of people are asymptomatic. Those are all red flags, meaning that if you're supposed to follow social distancing, you're supposed to sterilize and sanitize objects as much as you can. If you have a doorknob that multiple people are touching within your organization to go to the restroom, that doorknob needs to be sanitized. It needs to be cleaned with a disinfectant that is appropriate to kill coronavirus, like Lysol, bleach, and all those common ingredients. We'll go to the next slide. So, this disease has multiple clinical manifestations, and we'll go over these. Guys, this is important, Erasmo. Many people get exposure to the virus and believe that they need to test the next day. This is an improper way to test and to function as a community. For every person hearing this broadcast, you need to understand that there's an incubation period of 4 to 5, from anywhere from 2 to 14 days. The average, Frankie, is 5 days, meaning that most people that get exposure to the virus, that are incubating the virus, that the virus is growing within their body, can take them up to 14 days for that virus to show any sign or symptom. The average is 5 days. So if you have an exposure, Erasmo or Frankie, today, you're not going to be testing tomorrow, guys. Please give it over 5 days. If you haven't had symptoms within 7 days, then you're at a 50% chance of not contract that you will not contract the virus. If you cannot test within 1 or 2 days after the exposure, we when we were doing our scheduling for the city of Brownsville for our site, we would schedule exposure 1 week out. At 1 week out, we're able to beat that 5 day average and really know if someone was a possible contaminated exposure. And so this is important to understand incubation period. If you have an exposure, it can be as fast as 2 days or as long as 2 weeks. So you're staying out for 2 weeks. Now the clinical presentations at Erasmo, most people over, 80, almost 85 to 90% of folks have cough, have fever, cough. Fatigue is also very common. Shortness of breath, lots of body aches. But the main thing is cough, fatigue, shortness of breath, guys. Now there are some other non-specific symptoms like diarrhea. We see lots of GI issues, diarrhea, nausea. Not too much on the vomiting, but a very peculiar symptom of losing your taste or smell or having a metallic taste in your mouth. If you start noticing that you're having metallic taste in your mouth, or you're having a taste disturbance, correct? Or you're losing your sense of smell, that should be an indicator that you need to be tested. This is an early symptom of COVID-19. This virus in particular, Erasmo and Frankie, is very rare. We haven't seen something like that in several decades. And what I mean by rare is that it has a very wide spectrum of disease. Most people, 40% of people are asymptomatic. They have no symptoms. They can walk to HEB and be spreading it like wildfire if they don't use proper precautions and their masks, and obviously sanitize their hands and use sanitizer while grabbing objects. Other people have mild symptoms, which are non-complicated upper respiratory tract symptoms like mild cough, runny nose, and that type of situation. And other people have moderate disease. Moderate disease is going to be described as pneumonia. We're treating people for outpatient viral pneumonia that does not need supplemental oxygen. The issue with these patients is that most people do not have an oximeter that you can take and measure. Bring me the oximeter for the pen. Most people don't have this oximeter, the oximeter that other people can, other medical professionals could have, that, and they can place that oxygen level and monitor that. So that's an issue. But that would be a great indicator of disease, and that this actually warrants a hospital admission if your oxygen level drops below a threshold. Now, there's also the level of severe pneumonia. And these are people that are in severe respiratory distress and have pneumonia with lots of issues with oxygen in room air. And then we have critical illness, and this is where people actually can proceed into sepsis, shock, and even death. So this virus, within decades, we've never seen anything like this, from having no symptoms to dying. It's very rare. This is a sample oximeter that I purchased this, and we got to keep going to the next slide here. The spectrum of disease here is mild to moderate cases out of almost 45,000 individuals. There's moderate. Most people have moderate symptoms at 80%. 14% of people have severe disease, and only 5% are considered critically ill. We'll go to the next one. This is a disease that affects, as you know, older adults and people with underlying medical conditions. Here are some of the serious underlying conditions that COVID-19 could affect. Chronic kidney disease, chronic pulmonary disease, obesity, serious heart conditions, heart failure, heart disease, sickle cell disease, and diabetes type 2. I talked to a patient this morning. She lost her mother, and the only underlying condition she had on this slide was that she was obese. So even if you have an obesity of BMI of 30 or above by medical definition, you're at high risk for death and complications, which is very scary in our community. These are some of the considered diseases of COVID-19 with increased risk: asthma, cardiovascular disease. If you're pregnant, we've had multiple pregnant women that have had complications. If you keep reading, guys, if you're a smoker, obviously your lungs are not to full capacity. If you have cancer, you have HIV, you have autoimmune disorders. All these conditions make you at more risk for severe disease. So this slide right here, guys, is very important. It's kind of heavy, but all it talks about is the rate of hospitalizations between March 1st and July 4th. The reality is that most American, Hispanics and blacks and also American Indians have high risk of genetic diseases like diabetes and high blood pressure. And if you look at Hispanics, they're up there. Lots of hospitalizations are occurring in our race, in our population, and that's because of our genetics, and that's because of our obesity rates and diabetic rates. Some of the investigational therapeutics, guys, there's a drug called Remdesivir, and that's given IV in the hospital. People have had success with it. There's also convalescent plasma. I know that Frankie and Erasmo were pushing that donation for the plasma. The education is key for people for treatment, and also monoclonal antibodies that neutralize the virus. And so we can skip that slide. So this is a drug, Erasmo and Frankie, that was the only drug proven to reduce mortality while in the hospital by 20%, guys. So this is a drug that's very commonly used, and it's a corticosteroid that I do prescribe as an outpatient, and is given to patients with COVID-19 in the hospital. This is the only drug that was proven to reduce mortality by 20%. So this is a great therapeutic advance that we've made in the medical world, at least in the inpatient setting. This right here, Frankie, we call it the expert U.S. panel. They developed a living document, a living Bible, guys. Please share this on your site, COVID-19 treatment guidelines.nih.gov. The government has put together guidelines for the treatment and the management of the disease for every individual to go out there, from the regular common Joe to the physician to the PA to nurse practitioner. A lot of people are not up to date with this living document. So this living document is expanded and added to on a daily basis to make the most relevant expert medical advice for our country. And so the next couple slides before we finish off is the government is led by Dr. Fauci and NIH are putting together a strategic approach to a COVID-19 vaccine against the virus. There's multiple vaccine candidates, guys. There's actually a candidate here that's going to be phase 3 testing in McAllen. I think Erasmo posted that. It's called Moderna, and they're in a phase 3 trial. So they really put all their eggs into that basket because they've really shown improvement. And so I think we do have some big players on here like Merck, Sanofi, Janssen. These are all very vaccine giants. So we do have lots of players that are coming into the virus. I do expect for us to have a vaccine in the next 6 months. We'll go to the next slide.
I believe that's it, Doctor.
So this basically is saying that the vaccine that has been shown to provide multiple great results, and the safety is great. So they progress into a phase 3 trial. So that's an update from Dr. Fauci. He's presented this to the American people, and I think it's an important thing that we should, kind of follow through. and listen as a community. And if you have any questions on this, uh, we'll be more than happy to take those questions.
Thank you. What is the difference between pneumonia and COVID symptoms? I had a friend go into the hospital for pneumonia and now is fighting for his life against COVID. Hospital is putting pneumonia case with COVID.
So, you can have, obviously the organism, the reality is the following. It's a virus. It causes a mild disease, mild bronchitis, guys, or it can cause viral pneumonia. The pneumonia is an inflammation of those pneumatic vessels, and the bronchial tree causes lots of inflammation and discharge, pus, too many.
Doctor, I'm getting a question. How long do people lose their smell and taste for?
Oh, that is one of the first signs or symptoms that comes in, and the reality it goes up to 4 to 6 weeks, guys. Be patient with that. That's something that people fight and get very concerned about.
Doctor, we've seen, it's been all over, all over the web in regards to the boat this weekend at the island. What potential risk could there be from those type of activities that are continuously going on in our backyard?
Yeah, no, this is serious, guys, and we commend obviously the judge for I think he there was an article that he did provide information on this reality, and these people are obviously the boat crew is not really following the guidelines of social distancing, and then the people that pay to get on that boat have no thought process that they can go infect others and infect their own family members. For that being said, for a 1 hour boat ride, it's unacceptable, and that should be frowned upon. And also, they should be shut down. They should be fined, and I think that's something that we need to start focus on.
What are your expectations, doctor, for the vaccine that's being created right now? You previously mentioned how McAllen should be experimenting with this drug. What are your expectations for it, and how long could we expect, success for this vaccine?
Guys, the reality is the following. This is the vaccine. What's the hallmark of a vaccine, Frankie? The vaccine is supposed to get you comparable antibodies comparable when you got the virus, when you got the disease. And so this vaccine in Moderna trial, phase 3, they taking participants. They need 30,000 individuals, and they're coming to McAllen to do this as well. And they're proving that after you get this virus, you can produce the antibodies comparable that you can fight the virus and be similar immune to it. So it's very safe. I recommend that people sign up for that trial. I have no financial ties to that company, but I do have ties to science. And the reality is that the science does speak, and the vaccine has proved that it's going to phase 3. So it's a safe vaccine.
That's right. And a lot of individuals are asking to see if we can provide for them the same PowerPoint presentation. I don't know if there's any way you could send it to us. We'll be more than happy to share it, or if you could send a link and people will be able to find it. As if you'll let us have it, we'll surely post it. And individuals
Sure.
material. How long?
I have something better. I have the actual footage from Dr. Fauci as he presented it very calmly, and obviously he had enough time. So I'll send you that, and he literally walks you down the whole thing. Very, very, very good information.
Awesome. Thank you. Appreciate it. How long does the virus stay in an asymptomatic individual, Doctor?
So the virus doesn't say anything different from a symptomatic to an asymptomatic. The virus, we know that the virus could be in your system up to 4 weeks. And so anywhere from 2 to 4 weeks, guys. If you're asymptomatic, you could be sparing that virus. And that's the reality that we're seeing at this moment.
Dr. Hernandez, a lot of the individuals have a lot of questions in regards to the testing. A lot of individuals still don't understand what the testing timeline is for individuals after they test positive. Can you give us a rundown in regards to the timeline of what happens after someone tests positive? When do they have to get retested? And what happens if the individual retests positive? Or what happens when the individual retests negative? Can you give us a short timeline in regards to it?
We'll speak. For example, you go to one party, and then 2 days later you get a call from an individual in that party that says, "Hey, guess what? I tested positive for COVID-19." That is a confirmed exposure. Now that exposure, you've been exposed to the virus. You can incubate 2 to 14 days. You have to wait to get a test at least a week. Once you wait the week and you've had the exposure and you incubate, after you test, if you test positive and you confirm the diagnosis of COVID-19, okay, you are to go into medical isolation until otherwise. Okay, the health authority will clear you when you're cleared. We do know that 2 weeks of no symptoms is the safest timeline, but now CDC has guidance of the reality of 10 days no symptoms. So that is the reality. You test positive, you're to go home and isolate, and then a medical professional, at least for my group, when you test positive, we've talked to over 1,800 positives, Erasmo and Frankie. We've treated over 1,800 positives. We've done excellent with our positives. We haven't had one death from our medical treatment and judgment. We've tried as hard as possible to get to everyone. And our importance are the positive. If you are positive, you will be getting a call from us as soon as we can, anywhere from 2 days up to 7 days, depends on the lab. Now I have 3 labs that provide services to us. So the reality is the following. If you have symptoms and if you're testing, you need to go home and isolate for 2 weeks.
Simple. Dr. Hernandez,
Very simple.
very simple. Let me ask you, Dr. Hernandez. One of the things that I guess we started off with was the confusion in regards to the numbers. We see the numbers on a daily basis in regards to the individuals that are making declarations that they've tested positive. We also see the number of individuals who have lost loved ones here in the city of Brownsville, and they number in the tens, maybe up to 20 per day. With that said, Dr. Hernandez, a lot of the individuals here have been asking in regards to their concern because the school district is making individuals go back onto campus, teachers, staff, employees onto a campus, and our teachers do not feel safe. Our custodians, our workers do not feel safe because they think that the decisions that have been taken by this school board and by this leadership are based on not up-to-date numbers, sir. And again, you were very present in regards to, the Port Isabel board, and we thank you for that. And they thank you for that because they had information coming from a medical professional, one of the experts here in the city of Brownsville, sir, which I do consider you.
Thank you.
The city of the Brownsville School District has not had one single medical person, not one scientist, not one doctor. I know that one time you went there and were treated very ill, sir. But with that said, shouldn't they get advice from you or from someone that is a scientist or someone in the medical profession before they start sending people onto campus?
Well, I think I encourage anyone on the board, specifically, Eddie Garcia. He's on the board, and he's on the chair of a large medical organization, and I think he understands medical as well. So if he could get me out, I'd be more than happy to go out there and provide a Zoom meeting for them. The reality is this, Port Isabel. I have patients from Brownsville, Harlingen, Port Isabel, San Benito. We have an office in McAllen. We're all over 2 counties. We got 7 of our providers rendering services 7 times a week. 7 days a week. So, they're more welcome to get our experience. But Erasmo, the answer is really simple. The Brownsville Public Health Department, led by Dr. Arturo Rodriguez, which I consider now a personal friend of how much we talk about COVID-19 in the last days, in the last months, that man is a phone call away. He's a great leader in the city, and the school board should be going to him because I report every positive to the public health department here. Okay, so if they want accurate numbers, let me tell you this: City of Brownsville Public Health Department is every day up to date with positives and negatives because they get that report from us.
But
Hundreds and hundreds of these reports are sent to them. They have the numbers. The board needs to be going, should go, if they believe that the county's behind, they need to be proactive, need to get out of their chair, and they got to go speak with the public health officials from here to get accurate numbers.
Dr. Hernandez, what advice would you give the superintendent at school? And look, it's a given fact. They don't care to seek out anyone that's going to tell them anything contrary to what they want to do. They want to, tan tercos, they want to send people onto campuses without us knowing if it's safe or not safe. We've had a teacher pass away today. We had another teacher pass away a couple of weeks ago. We had already a food nutritional service person pass away. I mean, how many more deaths do they need in order to protect the safety of our personnel? With that said, what advice would you give the BISD superintendent school board about the educational approach for this year, sir?
So I think they should look at the reality is, let's focus on the real numbers. Have them talk with the public health officials. Have them talk to people that are treating COVID-19. And the reality is they need to come to that line and say, you know what, let's put all the differences aside. Let's put all the politics aside. Let's put all the indifferences aside. Let's level this out. This is for the benefit of the community and the children. Not only that, that food service worker was an excellent human being. He was a patient of mine for many, 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 many years, okay? So those deaths hurt. They hurt because they're people that we've invested our time and our knowledge and our love as patients only to contract this virus in that environment. That's unacceptable.
100%. What do you think about the AstraZeneca vaccine, sir?
I think Jessica is always in the forefront of questions, and these vaccines there's 6 major contenders, guys, and the reality is I did call the Moderna people in McAllen. I do want to get the vaccine. I encourage people to go get the vaccine. It's safe, phase 3. I'm talking as for the reality of human sake. Let's get this going, and we want to say to Abel Gomez, good luck on his race, and we just stay positive. There was an individual that mentioned dexamethasone not to be used as an outpatient setting. I think his name is Carlos. With that being said, Carlos, the reality is this: I don't have time. After treating 1,800 positives, and not one of our efforts has ended up dead, I don't have the time or the energy, or I'm not going to wait on any entity to tell us what we can do as an outpatient. My goal is to treat, to identify, mitigate, control, and isolate individuals, and if necessary, treat positive so they don't go and overcrowd the health system and the hospitals. Amen. The hospitals could no longer, if we don't do our work on the medical community on the outpatient side, the hospital will be inundated and it will be a catastrophe as what we're seeing in New York City or we have seen there. We need to step up on the outpatient setting, test, identify, treat. So I'm not going to wait for any guidelines to come out on the outpatient. If I know dexamethasone works for bronchitis, and we know that it works on the inflammatory purpose that kills the individual in the hospital, it's very safe for that drug to be used as an outpatient that if the patient's not diabetic. So I'm not going to wait for that. We're going to be aggressive and we're going to treat.
Awesome. Dr. Hernandez, have there been any additional studies? I remember this question came up some time ago in regards to the nicotine or to combat the virus.
So the nicotine, the reality is, guys, that the virus is also can be inhaled through the olfactory bulb, and there's some nicotine receptors. So when you're using the patch, you block those receptors, okay? And when it blocks the receptors, you're unable to contract the virus, and then that is an excellent way. When we went at Erasmo to test 1,900 nursing home residents, when no one else went in there, no one else volunteered to go in there. When the judge asked me if we could do it, guess what we said? That we can do it.
And you,
I put all my employees in nicotine patches because that's what the French workers are doing. Okay, we're looking at what other countries and other people are doing around the world that is providing success. Again, we're not waiting for guidelines as an outpatient. We're being proactive.
Dr. Hernandez, have you answered this question in regards to the you were positive and now recovered? How long after recovery can their blood still help others if they decide to donate?
So, as long as you're asymptomatic, you've gone over 2 weeks with no symptoms. Usually by day 28, you have enough IgG antibodies that are neutralizing the memory antibodies against the virus. So, if you wait 28 days, it'd be an amazing time for you to donate and save a life.
Could you give a little bit of discussion in regards to the different types of tests out there? And also, just to add on this question, if you're negative on the swab test and then positive on the antibody test, are you still positive?
So there's some. It is very sad to see, Frankie and Erasmo. There are some clinics here in town that are focused on antibody testing. With that being said, the antibody test is an important test, but that is a screening test. That's not a diagnostic test. The diagnostic test comes from the PCR nasal swab. Now, if you're positive on the antibody test, you have two antibodies. You can have an IgM antibody, and that antibody tells you that you have an acute infection, but you could also have an IgG antibody where you're transferring from a acute to chronic or old infection. If you test positive on your blood test on the IgM, guys, please, you need to have a nasal swab for confirmation. And this needs to be reported to the health department, and you need to go home and isolate. There's so many mom and pop clinics here in this town now doing blood tests. That's not the way to diagnose COVID-19. You cannot get a diagnosis from COVID-19 by a simple, rapid antibody test that might not even be approved by the FDA. Be careful where you're getting your test from and who you're getting your test from.
Doctor, I have a question from a person that works at a physical therapy clinic. Several employees have tested positive in the last month. The staff owner does not want to professional disinfect the office. They want the staff to do the cleaning. What is the proper protocol for a situation like this?
Look, I think our leadership has great guidance. Have you seen several restaurants have closed down, and the health department is very active. If you believe you're an employee and your employer is creating infractions that is making that environment unsafe for you to work or others to go and get a service at that location, please call the public health department. They will send an inspector, or they have CDC nurses that are involved in their treatment plans and a recommendation. So they're very active. They will get someone out there. Awesome. Make a report to the public health department. They're excellent.
Why are people that are diabetic at high risk?
The reality is most people that are diabetic are immunocompromised, and so the sugar tends to produce lots of micro-inflammatory components of heart disease, kidney disease, and it makes the individual more susceptible to superficial infections like pneumonia, MRSA. You can develop other infections in the hospital. So with that sugar being high, it's like if the viruses and the bacteria are feeding off you.
Doctor, with the CPAPs, are they being prescribed to patients who are at home receiving treatment?
So most of the time, the CPAPs are prescribed for people with sleep apnea. It's been proven on a sleep study. I think they're using BiPAPs in the hospital. It's not common to be, when you leave the hospital, be prescribed a CPAP, but they should be prescribing, and they do prescribe oxygen at home by oxygen concentrators.
Doctor, how effective are sanitizers that have been expired for 9 years?
Oh, no, stay away from that. Just mix some Clorox and some water.
Doctor, in regards to the trials out in McAllen, and actually, the honest truth, when I first heard about the trials out there, sir, in McAllen, I had questions myself, and that's why I hesitated a little bit. I did get a little bit of information from Dr. James Wittenberg in regards to the trials, and I felt a little bit more at ease in sharing it, which I did. But what are the risks for vaccine trials in McAllen for MIDA?
So the reality, MIDA, every vaccine has the risk. There's 1 in a million chance you could get Guillain-Barré syndrome from a vaccine. Vaccines are proven to prevent disease, and the reality is the following: vaccines are safe, and the reality is when you go into a phase 3 trial, we will have no problem with human safety, and this is being led by the U.S. government and the NIH.
Good job, Dr. Hernandez. Again, one of the major concerns in regards to to a lot of individuals here in the city is the second wave. We always hear about this second wave. The second wave. Uh, are we going to get a second wave? Are we in the second wave? Have we peaked? Are we plateauing? Where are we at in regards to those different scales that were very famous some time back?
I think right now we're in a tsunami, and we need to be aware. We need to be vigilant, and we need to treat the person like if they're infectious. If you don't know their status, there's no reason why you should be in a boat party with them. There's no reason why you shouldn't be wearing a mask next to them. There's no reason why you shouldn't social distance, and that's the reality. Okay, right now people are getting infected from family gatherings, guys. Very infected. Oh, by that, Robert Reyes, anytime you have an inconclusive report, you treat it as a presumptive positive if you have symptoms. Because if you didn't have the virus, you wouldn't have a loss of smell or cough. So if you have an inconclusive, go home and isolate yourself for 14 days. Call your medical professional.
Dr. Hernandez, I have blood pressure that I maintain with a pill and a lot of exercise, lot of exercise. Trust me. I keep my numbers are in check. I keep my numbers in check, even though I'm healthy. Will my exercising and boosting my immune system help? I hear of healthy people getting sick. Any reasons why?
The reality is the virus, attaches itself on our presentation to the ACE2 receptor in the lung. So we all have those receptors in our lungs. So if you're exposed to the virus and you breathe it in, doesn't matter if you're Superman or not, you're going to get this virus.
What's the? I mean, what is the issue now, doctor? It seems that has it always been this way? I mean, I know that you've been following this. This wave that since it's come from Europe, Asia, now down to New York and down here. Is there a reason why we're getting a lot of 40-year-olds that are coding, a lot of 30-year-olds that are dying, a lot of 20-year-olds that are dying? Is there a reason for this, doctor? I mean, were y'all expecting this?
Yes, genetics, guys, and the prevalence of diabetes is so high in our population that we have a three more times the mortality rate than other people with COVID-19 of other races. Because we're in this population as Latinos, our genetics are predisposition for diabetics and morbid obesity and these issues. On top of that, you have a virus with a wide spectrum of disease. You're going to have more complications. Why do you think we've been on Ben Shapiro? You think he would have an interest on the Rio Grande Valley as Ben Shapiro? I don't think so. Why was the Cameron County Health or the Hidalgo County Health Authority on the news with Cuomo? Right? This is an epicenter now. The deaths are very, very high, and that is because our genetics, our components, and the way Latinos are highly hospitalized. If you look at my slide, there was a slide on Fauci that Latinos were hospitalized very high compared to other races.
Yeah, just by being Mexican, I mean, we carry a lot of. I mean, once you started going down the list of, being diabetes, obesity, and going like, oh my God, that's like 90% of our population here in this area. Sure, if someone was positive with symptoms, 15 days later they retest, and after 7 days, no symptoms but still positive. Can we safely be around them with a mask?
Yeah, so remember that the virus, not because you test positive after 2 to 3 weeks, the reality is that you're infectious. Now, if you need a negative result to get back to work, that takes 4 weeks. 4 weeks. Okay. Now, there's new guidelines that say if you've been asymptomatic with no symptoms for 10 to 14 days, you're cleared, and the county will provide you the form. So that's important. Now, with that being said, as science is changing every day, do you want someone that's COVID positive after 2 weeks breathing down your face?
No.
Stay away from them. You wear a mask. Let them wear a mask. Let them obviously sanitize what they're touching and keep your distance from them, please.
Dr. Hernandez, a lot of individuals are asking if y'all are still taking patients at y'all's office. If you are all seeing patients at your office, what are your hours and where are your offices at, doctor?
So we never shut down. We're still, full service telemedicine. We got 3 locations. We got seven providers. We do take care of all of our old patients, diabetics, hypertensive. We consult people in McAllen, in Brownsville, Harlingen, San Benito, the island. That's it. We're open for you guys. Give us a call. Let us know what we can do for you. And a lot of people do message me with any issues. They're waiting on lab results or have a concern. I do get to those. I take all that personally because I feel responsible to the community to do my best job.
As a stylist, how much risk am I doing my job? Everyone in the salon is required to wear masks at all times, and we disinfect with barbicide before and after every client, as well as washing our hands between every client.
Yeah, so I think you guys are at high risk, stylists that are high risk because you have very close communication and contact with an individual and the way they breathe. So if you're a stylist, make sure you're using the barbicide that has the viricide to kill the viruses, and make sure you're wearing proper mask that's fitted, and also your the patient that you're cutting their hair fitted, and get them in and get them out. Okay. I went to get a haircut. You see this nice haircut? I had a huge.
It's amazing.
It was a horrible hair, and I went to the supercuts, and there were one person in there. The person walked out, and I took 2 N95 masks and I gave them to the stylist. And I told the stylist, you go to the back. I just want to be with her. And it was a 1-to-1. I was out in 10 minutes or less. I had my mask completely sealed, and she had an N95. So there's ways to prevent the spread.
In regards to the Lupita's question, I think doctor mentioned 4 weeks. Is that correct, sir?
What was the question for Lupita?
Pregunto cuántos días son los correctos del virus, 14 o 30.
Sí, el virus se queda en tu sistema entre 12, 14 a 30 días. La realidad es que va a estar positiva en su examen por 30 días y tiene que tener cuidado. Ese virus se puede transmitir muy rápido. Si usted tiene síntomas, quédese en su casa por mínimo 14 días sin síntomas, por favor.
Doctor, we got word today that Hidalgo County reported 49 deaths. And you mentioned earlier that we're in the middle of a tsunami. Is this something that Cameron County is going to be experiencing, that amount of death rate?
Yes, I think the kicker here, Frankie, was that the health authority came out and said that they are behind, that they're working as fast as possible, and there's a lot of reporting that needs to be done. I don't know the exact date, but that's a reality. So we do expect more deaths that haven't been reported to be reported, and we're always in the lag. Now, we report to the health department here locally on a daily basis. Let me tell you this. I give props to the city commission and to the mayor specifically, and to the public health official, Arturo Rodriguez, because that man has been on COVID-19 before this, mitigating risk on a daily basis. He has the numbers. The school district needs to go to that man.
Dr. Hernandez, I'm going on 6 weeks of going through the COVID-19 virus. I retested and my results were positive after still 6 weeks. When do you recommend I retest? Is it normal for the virus to stay this long in my body?
So now the new guidance, guys, on CDC, they don't recommend retesting. The virus does take prolonged time on the body. I told you anywhere from 4 to 6 weeks. So it's important for you to understand this. It doesn't mean that you're infectious. It's just you have some viral particles in your nose. That PCR test is very sensitive. And if you have any RNA of the virus, you're going to test positive. It doesn't mean that you're infectious.
Good. What are the numbers of volunteers for phase 3 clinical trial in order to be considered a valid trial and safe enough? Are there any adverse events or significant severe adverse events for these patients?
I think, Edna, that's more of a clinical scientist question. The reality is If you want that number, look at the clinical trial. I'm gonna post, Erasmo. I'm gonna post you the link to the U.S. clinical trial on the vaccine. Okay, look at the numbers yourself. Phase 1, phase 2, and when it goes to phase 3, it's past several guidelines by the NIH and the FDA. They're not gonna put just a mom and pop vaccine that causes harm to humans. So this is important. I think we're at a good step with vaccine.
Doctor, someone was asking in regards, Sherry was asking in regards to vitamin 1000 vitamin C, D3, 500 zinc, Mg, magnesium, 400 milligrams of elderberry. Are there anything you would recommend?
So if you get diagnosed by COVID-19 by me, I am prescribing vitamin D, zinc, okay, not the magnesium, not the elderberry, but there's some vitamins and minerals, specifically vitamin D and zinc. And now, guys, melatonin, which is a hormone we use to sleep, has been shown to prevent cytokine storm, and it works.
Oh, we got that one.
Doctor, is there a use for Tylenol? They've been asking me that they've been only prescribing them or recommending ibuprofen. What would you recommend?
So early on, they mentioned about ibuprofen and NSAIDs causing dysfunction with the virus, and people were focused on Tylenol. And I think because if you take high amounts of ibuprofen, you could damage your kidney. If you damage your kidney, then you're going to have problems with this virus, because people that are on dialysis are the people that are dying. Okay, they're at high risk. So Tylenol is very safe. Now that doesn't mean that you cannot take ibuprofen, but just take it carefully. Now sometimes when you talk about a fever, guys, the body's response to kill a virus is getting a fever. Why would you want to stop the fever if that's the body's response to kill the virus? We also need to work with human physiology here. And so the way God prepared the body is, if we have an intruder that comes in, we elevate our temperature to kill that virus. So if your temperature is 103 or above, then take measures of antipyretics, cold showers, whatever you need to do. But if you have a temperature from a 100.4 to a 101, hey, try to write that out, because while you're elevating the temperature, you are killing the virus as well.
Will the elderly end up dying by taking future COVID vaccines since they have weaker immune systems, sir?
No, I mean they generate the immediate amount of antibodies that's needed, and so if you can get the vaccine, get the vaccine.
Sir, in regards to a lot of the one of the things that was brought to the attention of, I guess, the news media was the 85 infants that had passed away up here in the Corpus area, and we know that there were 85 infants since the time it started. That was made clear later on. So why are infants in our area succumbing to it, sir?
You know, the reality is infants do not have a good immune system. And so when the infant is born as a newborn, most of the time it gets a nice colostrum with antibodies from the mother. And so if there's not adequate time of these antibodies being given to the patient, to the newborn, their immune system is barely getting introduced to the outside, to the world. And so an invader like COVID-19 can actually cause death on a newborn, and we've seen this already.
Too many. 85 is too many. Minero La Pingüina is asking, is there any information that you can provide about using budesonide with a nebulizer? Is this an actual treatment that can be used?
So I think, Frankie, you did see my post about, there was a physician that posted that there was a silver bullet against the virus. I think this is something that needs to be addressed. The reality is, budesonide is Pulmicort. We use this for COPD asthmatic patients, but this does not help the cytokine storm that kills the individual. This is a local reaction of the steroid that works in the respiratory tract. This is not a silver bullet. The silver bullet that we have is blocking that inflammatory response with the dexamethasone as an inpatient to prevent the body from going into a cytokine storm that shuts down the human organism, the sepsis, and all these other organs that shut down the inflammatory response. So it does have purpose, but at this moment, I don't see it as a big time silver bullet as being promoted, guys. It's more important to block it systemically as anti-cortical steroids than an inhaled corticosteroid.
What can you tell us about a blood antigen test versus an antibody test?
So there's no such thing as a blood antigen test. There's a nasal antigen test. It tells you have the virus actively. That's a 90% accurate. The PCR is 99% sensitive, and the antibody test is something that you should not be focused on at this time.
This is a kind of a question I get a lot, sir. What do you think about employer asking employees who has already been tested but hasn't received the results to return to work because they haven't had any symptoms?
So the employer is asking them to come back, and they can't wait for the results, correct? So they should be reported to the Cameron County Health Authority. Let them deal with him. That's incompetent, and that's not a fact. That is not correct. That is not a proper way to function. How could you bring someone that possibly is going to test positive? Remember, 40% of people are asymptomatic. If you bring that individual in and test positive, now you expose the whole team, your whole staff, just because you needed that person to come back to work.
That's crazy. How do throat infection symptoms differ from COVID-19 symptoms, sir?
Very few people have throat symptoms, Ricky. Very few people have any symptoms that have to do with throat. Very minor symptoms of sore throat. Those are not really indicated for COVID-19.
It's Dr. Eder Hernandez, and I know that one of his offices is on Boca Chica, right off there where Bonanza used to be.
Bonanza.
Bonanza. And the other office is here on Alta Glore, and I know that's where Jones Liquor used to be. Don't ask me why I know where Jones Liquor used to be.
Doctor, I'm getting a question. Is it safe to take my 10 and 12-year-old children to eye exams or dental appointments?
Let me tell you this. I had a patient test positive because she went to an eye exam. Okay. The only source of travel that she had was with the time frame of the virus. She went to a local eye exam. So it's possible they got infected with maybe one of the staff members. So remember, the virus does transmit with the eye. So if that machine is not cleaned properly and they're doing an eye exam, be extra careful. If you don't need to be at the eye doctor, don't be at the eye doctor. If you don't need the dentist breathing down your face, you don't need to be there.
Greg,
this is a pandemic. This is cosmetic. Now, if you have an emergency, go visit your eye doctor and go to the ER. But if it's not an emergency, you don't need to be there.
Dr. Hernandez, one of the things that has come out recently is in regards to being O positive, the blood type, O positive or O or A positive. Does it make a matter? Are some individuals with a certain blood type less prone to get the virus?
So the issue there is that the virus does have some affinity, and it does integrate itself to red blood cells, which is why you're having the strokes and the deaths and the thrombolytic events. And so depending on the blood type, they're looking at which blood type is more susceptible. And I don't have more information on that. I haven't really focused on that much, but that's where that logic is coming.
Like, I was diagnosed with pneumonia, but I did the swab test and it was negative. Is that common?
Remember, PCR test has a 30% negativity rate. It could be a false negative, but on a CAT scan, if you get a CAT scan, COVID-19 pneumonia looks like COVID-19 pneumonia. It's very obvious if you have it. So if the physician lets you know that you're having it and you test negative, if it smells like COVID, feels like COVID, talks like COVID, it's COVID, guys.
There's no doubt about it. Dr. Hernandez, on fire, Valley Med Urgent Care. Again, Valley Med Urgent Care. Thank you, Dr. Saavedra. On Boca Chica, close to where Bonanza used to be. And the other one on Alta Glore, where Jones Liquor used to be. And again, don't ask me why I know that. Diabetes is a pandemic and needs to be addressed as such. Junk food, yes, 100%. One of the things I think is very important, Dr. Hernandez, is, start eating healthy, folks. Start building up the immune system. Nada les cuesta, especially in a time like this, to go out there and do some exercise, like my friend Aaron, but don't do that much exercise. But a healthy lifestyle and changing a lot of the bad habits that we have, like going to Jack in the Box after the show to getting loaded tiny tacos is not a good idea, sir, right?
Yeah, I think today I start off my day, Frankie, by speaking to a 27-year-old that lost her mother to COVID-19. And the only risk factor that she had was that her mother was obese. So, she mentioned that she was very fit and she was into fitness and she wanted to kind of promote fitness in the community because now if you have obesity, that's a very serious risk factor and people are dying just because you're obese. This should make us become more fit. And now, at least for us as a family, we're working out. We've never worked out together. We're working out at least 3 times a week, even with our children in our home. So we're finding times to do things together.
Dr. Hernandez, again, one of the major concerns for a lot of individuals is going back to work. And again, we get that regularly and constantly. And a lot of individuals, I don't know if you've seen the comments, but they said, please give that information to the BISD board. And I think part of the problem is right now they just don't want to listen. I'm going to applaud the Port Isabel board because they invited you there. They wanted to have you there because they wanted to make the decisions that they made based on the facts. And that's one of the things that we try to do here, sir. We try to bring in the facts. A lot of people may say, es que no quieren a la Minerva, no quieren a la Silvia. It's not that. We care more about our community than we care about putting money in Sylvia's pocket. So with that said, Dr. Hernandez, if I'm understanding correctly, based on the slides that you showed us, based on your experience as a fighter, a warrior against COVID-19 in our area, and I would dare say one of the leading medical professionals out there, sir, what is your suggested recommendation to the superintendent and board who are watching in regards to sending our people back onto campuses, sir?
I think they should pick up the phone. They should call Terry Alarcon, which they're very familiar with, and speak to her about what decisions they took. And also, attorney at law, one of the board members, Heather Scott, which was she invited me to come on board with the Point Isabel School District, and they took decisions based on the reality and the numbers. And so we're not here to send our children into invisible war. They're not vaccinated. We don't have medications that fight the virus. This is not the flu. This is causing lots of complications. And so in all reality, they need to seek professional advice and they need to stay away from political agendas, but look at the facts. Bring in Dr. Zamir. Dr. Zamir is an expert in pediatrics.
Amazing.
He's an amazing man. He's a good friend of mine. And the reality is he can give them a proper recommendation and go to the health department here. Why wait for Cameron County Health when they're telling you they're swamped? The health department here has all the positives from the drive-through. The health department here in the city of Brownsville has expanded the testing to 2 other locations. It's just not the sports park now. There's 2 other options, and I think that they've done a great job for adding other providers.
Let me make this announcement very quick. The city of Brownsville has reduced occupancy rates to 25% for restaurants, for gyms, and for bingo halls. So again, guys, the city of Brownsville, and again, thank you so very much to our city commission. Thank you so much to our amazing mayor out there. Thank you so much for seeing the situation that we're in and for reducing the occupancy rate of restaurants, gyms, and bingo halls throughout the city of Brownsville. Guys, these are decisive measures that, basically let us know that we are not in a good position here in the city of Brownsville. And I'm hoping that the Brownsville Independent School District pays attention as well. Stop sending my teachers, my counselors, my staff onto a campus. Limit them to 25%. Adhere to the guidelines set out by the city and no sean cabezones, no sean tercos. Stop trying to say, we working together with the city and then kick sand in their face. But Hernandez, if a person is diabetic, and I get this a lot because we have a lot of individuals that are on dialysis, But if a person is a diabetic getting dialysis treatments and has the virus, what treatment will be given for them? Will he recover?
So unfortunately, diabetics on dialysis have very poor turnout rate, guys. These type of patients have a high mortality rate. Once you go on a ventilator, there's a 30% chance that you will not make it. So it's highly important that if you have family members that are diabetic going to dialysis, if you are have anyone in the family that is not taking proper precautions, they can infect that individual. That individual could die within a week if they get the infection. Please be extra cautious with diabetics on dialysis.
Doctor, what's your recommendation to first responders and medical professionals? They are at the front lines and probably more susceptible to contracting this virus. What's your message to them on combating this virus?
So, first thing here, Frankie, with this comment, I want to commend the mayor and the city commission. Also, the fire chief has been involved to an extent there, and emergency management. They have a system where they identify and bring in first responders for immediate testing. They have amazing system to diagnose, to help them get the test and diagnose. And so these guys, these EMS workers, paramedics, policemen that have been infected, they're putting their lives on the line for the city. Okay, not on top of the nurses, the physicians, the PAs, the nurse practitioners, the people in the community that are putting their lives on for other people have the respect to follow the guidelines because we have families as well. And if you infect me, I'm going to come and infect my family, and that is not how this works. Give us the respect. Give the policemen, give the firemen, give the paramedics the respect because day in and day out they're exposed to this damn thing, and they're doing it. They're not doing it for monetary purposes because trust me, if someone could take leave for a month and not fight the virus, they would do it. But these men are out there on a daily basis fighting COVID-19.
Dr. Hernandez, let me see. Oh, this is a question by Norma. ¿Qué riesgo corre un individuo que salió positivo en COVID que le dé otra vez? Sabemos de la doctora aquí en el Valle que fue positiva y después le volvió a pegar. ¿Cuál es la probabilidad que la persona que salió positiva pueda volver a salir positiva?
So, si haces el examen entre 2 a 4 semanas, tienes una probabilidad de 90% que va a salir positivo. Eso se puede tardar hasta 4 o 6 semanas en estar negativo. Y no es muy común que una persona tenga la infección otra vez muy rápido. Sabemos que la inmunidad puede tener 3 a 6 meses por los estudios que se han visto desde China. El virus empezó en diciembre. So, no sabemos exactamente cuánto tiempo, pero mínimo 3 a 6 meses sí tiene protección.
Dr. Hernandez, one of the things that we learned today was that UIL was planning to send our students back on to practice to prepare for sports, sir. They're talking about football, they're talking about basketball, they're talking about all other sports, and they're talking about band, sir. A COVID-19 outbreak among Hazard Independent School District football players has spread by Monday to 38 people. Sir, what is your take on our students, athletes, band students going back onto practice and to actually perform or to play?
I think, if there's a school district that is allowing this, I think now the parents are going to be responsible for the safety of their children. You understand that this virus is transmitted through close contact, breathing droplets. Imagine how much virus is in sweat that has secretions that can go into an eye. So if you're a parent and you have your child in combative sports like basketball, any of these sports, please keep your child or you're at home.
Doctor, you have previously mentioned how people who are diabetic, are susceptible and will have a stronger time of recovery. Could you give us a percentage of how many people you have treated that are diabetic that have, recovered, so to speak, from this virus?
So I don't have those numbers on hand, but I know we've treated over 1,800 people that have been positive, and at least 40% of those individuals have been diabetic. At least.
one of the other things that I will mention in regards to some of the decisions brought forth by our city commission, the social city commissions, city of Brownsville has also increased social distancing to 8 feet,
Look at
eight,
that.
8 feet at restaurant tables, and mandatory face masks at gyms. What are your thoughts, Dr. Hernandez?
I mean, look at these individuals. I think it helps that they have a physician on board. Rose Gowen is actually commissioner by elected official, but she's also a physician and she understands these guidelines. And I think because she's on that board and also the mayor's very proactive, he's always reading. We're always texting in regards to what are the new ways we could combat the virus and help our community. He's always a phone call away. He's very, very someone that you can reach. And also our commissioner, Jessica Tetrao, she's also very engaged with the virus, with combating the virus. So the fact that they've gone above and beyond 6 feet tells you that they're very aggressively fighting COVID-19.
Dr. My dad is diabetic and has high blood pressure. He's a cancer survivor. He has an ultrasound on Monday, but I'm scared to take him. What would you recommend?
So, I mean, the ultrasound, obviously, there's a reason why the ultrasound is being ordered. And now you need to look at benefit and risk. Is there more benefit for him to get the ultrasound and diagnose a condition that could be life-threatening, or if it's something that can wait and is more of an elective issue? Because unfortunately, you don't know if the person is in any medical spot is considered a hotspot, and you don't know if that individual performing the exam is affected.
Doctor, one of the city of Brownsville drive-through has had 11,000 tests, sir. 11,000 tests. Are we going to continue to see more testing done in the city of Brownsville?
Well, I think the reality is the mayor has added, with the city commission and the public health director, has added 2 more locations. The second location is at the Port Clinic with Dr. Antonio Diaz. He's been an excellent physician for 35 years in the community. He's got a location there. And then the third location is, I think, with possibly Dr. Hussein. I'm not sure if it's him, but that's at the doctor's hospital. And so you have 3 locations where they expanded the testing. And the reality is that, they're expanding testing. And so we need to test, isolate, mitigate, contact trace, and separate those individuals that are infected.
Is there a difference? I'm sorry, go.
No, Doctor, a lot of individuals are asking information in regards to your clinic. We're going to post the information, but is there a specific number? A lot of individuals have been trying to call, and again, we know you're very, very, very busy. Yeah. But is there a specific time that that y'all more a little bit less busy?
No, we're busy from 7, possibly 7 a.m. to about 9 p.m. But anyone with an urgency can get to me. I'm always very, very able to get on and take care of your issues. And if you cannot get through the clinic, I will personally set up the appointment with one of our providers and myself. And then here's a website called ValleyMedCovid19.com. We're also doing private testing for necessary people. And the reality is we're here to combat COVID-19 on a daily basis. And if I haven't gotten to your responses, last resort, get a hold of Erasmo. He does send me messages. This person is looking for you, and I will get to you. I wish I do need to set up more phone lines. So if you have any volunteers that can help me set up more phone lines, I think that's important. Our phone line is literally, we become a call center. We get a call every 10 seconds. It is nonstop, 700 calls in one day.
Oh, I believe it, Doctor.
Doctor, is there a difference between type 1 and type 2 diabetes?
Yeah, type 1 diabetes is a genetic component where the pancreatic islet cells stop producing the insulin, and that is genetic. And those usually diagnosed when you're a child, anywhere from 7 to 10 years of age. Type 2 is one that you have by genetics, but over time over time, and this is the more prevalent diabetes. Most people in the Rio Grande Valley are type 2 diabetics.
Dr. Hernandez, we're at an hour and a half already, sir, almost. Any other last bits of? Oh, well, wait one moment before I don't want to. We got Mayor Mendez. Good evening, guys. Thank you so much for your work. Now we just need more people to listen. Amen, brother. Mayor Mendez, thank you so much for the new, the new guidelines for the city of Brownsville, man. It's what we need. It's what we need, and very, very proud, very, very proud of the decisions being made today. Again, we hope that the county follows pursuit. The county commissioners start doing a little bit more out there. But thank you, Mayor Mendez, for your leadership in the city of Brownsville. Dr. Eder Hernandez, any other information that you think might be useful for our people out there?
I think in this pandemic, we all need to be able to unite and help each other, put away differences, put away political issues. Let's all come together as a community. I do see lots of people with COVID-19 depressed, hurting. They're confined to specific spaces, and they're not used to being home. They're not used to not working. They're loss of income. I encourage you to reach out to those people via Zoom or via phone call. That makes a big difference. I encourage individuals to go outside. If you're COVID positive, or even if you're not, go outside in your backyard in the privacy of your own home and take some sun. Do meditation, get out. If you're confined to spaces, you are more prone to having these issues. There's been suicides that we haven't talked about. There's been people that committed suicide. There was a physician, an ER doctor in New York that took her own life from COVID-19. This is serious stuff, guys.
It is. Dr. Hernandez, again, thank you so much for your time. Frankie, last words.
Thank you for your time, Doctor. It's important for us to hear from you. We know you're very busy, so thank you for taking some time off and answering the community's questions. It's getting very serious. We understand that Cameron County is behind in regards to reporting numbers. Hidalgo County just reported 49 deaths. I believe Cameron was at 17 for today with 300 positives. This is only upon us. I understand that there's a sense of urgency to get back to some sort of normalcy. It's unfortunate that we've seen over the weekend how people are still partying, having a good time, and disregarding the recommendations from Dr. Hernandez and other health officials that are recommending stay away, stay home, only travel for essential items and back. So hopefully, these type of presentations done by Dr. Hernandez will encourage us and others to avoid being out in public, doing our best to prevent this virus from getting any worse. Thank you, Dr. Hernandez, and thank you, everybody, for your time.
Guys,
thank you, guys.
Thank you, guys. Again, it's a good day. We've got some good news to end the evening tonight. We got a lot of great information for Dr. Eder Hernandez, as always. Again, Dr. Eder Hernandez, whenever he has time, he's always welcome to come on here. Again, we have to understand that his time is very, very tied up, very valuable. He takes an hour and a half of his family time, of his personal time, to be here to answer your questions and to share information with us. So again, thank you, Dr. Hernandez, and thank your family for us, please.
Thank you, guys.
We will be providing the link and the slides that Dr. Hernandez showed today. We will be sharing them on my page, so you'll have that information. Again, guys, anything. One of the things that I will say about Mayor Mendez and Dr. Eder Hernandez is when they say we're in this together, they mean it. They mean it, and that is what is greatly needed in the city of Brownsville. Someone asked a question if Dr. Hernandez would run for BISD board. I really wish he would, actually. But I know that right now his time is consumed in saving lives and helping individuals. So again, that is a million times more service than being on the school board, especially the school board that we have now. With that said, guys, please, if you know anyone out there that has tested positive and needs food, go take them food. If they need medicine, go pick up their medicine so that they don't have to go out. Please leave it at their curbside, leave it at their front door and leave. Put a little note there if you want, guys. Please, this is the time for us to really, truly come together as a community and fight for our health, our well-being, and the life of our community members. God bless. Take care. Please, please be good to each other, and please be good to me. Hasta pronto.
Thank you.